Home health care and skilled nursing facility benefits. Hello, I am Kevin Knaus, an independent health insurance agent, and I work with individuals and families to enroll them in different plans through Covered California or direct with the carriers. And most all of the California health insurance plans, small group, employer group, individual and family, will have home health care and skilled nursing facility benefits in them. And these can be a real life-saving benefit that can really save a lot of money. And a lot of people just don't focus on it because thankfully we never get to that point. But so you are out hiking around or you're mountain biking and there's just a horrible accident, and you know it's just more than just a trip to the ER. Maybe it's a broken pelvis and you're gonna need some therapy, and then the question is, are you gonna be staying in the hospital all that long? No, they want you to get home or to a skilled nursing facility because it is so much less expensive in those places once you're stabilized. So the health plans will cover home health care services. And if the doctor says, yeah, this individual, you need to go home and we're going to send people out there to take care of you. Now the doctor is going to write the order and then submit it to the health plan. They need to authorize it, and then they start working on getting the providers of the different services to come to your place. And within the health plans, you are allotted 100 visits per year, up to 3 visits per day, and each visit can be 2 hours in length. And each visit can be from a different sort of provider. Maybe one time it's a nurse, another one might be a physical therapist, and maybe something else. This doesn't revolve around people coming and helping you get dressed or bathed necessarily. There can be some of that embedded in it, but this is really directed at getting you well again so that you can walk and get back to work or whatever it happens to be. Now, the costs for these home health care visits are going to be based on the metal tier of your health plan. So we know with bronze plans, you're going to have to move through the deductible of the plan, then you go into 40% coinsurance for the services until you reach your maximum out of pocket, and then the health plan covers everything. The silver through platinum plans, the home health care visits have a set copayment with it. You do not need to move through a deductible. So that is really nice. It's kind of like an office visit. They're bringing the office to you. They're bringing the physical therapy to you. So it's kind of an office visit copay situation. Not subject to the deductible, but of course, once you meet your maximum out of pocket, and you may have done that just with the emergency room and surgery, who knows? Everything is going to be covered. And I have had several clients who have used these particular benefits. And yeah, once they hit their maximum out of pocket, the health plan covers all of those visits in the skilled nursing facility 100%. Now, where do you find all this information? It will be in the summary of benefits and the evidence of coverage. And sometimes that's a combined document. But this is the summary benefits for a PPO plan, a silver plan, and it mentions right there home healthcare services up to 100 visits per member per calendar year. And the cost per visit is $45 regardless of the provider, what they're doing, nurse or physical therapist, and there is no deductible being applied. The next summary is from an HMO plan, a silver plan. You can see it states 100 visits per accumulated period, $45 per visit. So that's kind of nice. Now, to get into the very specifics of what this home healthcare benefit will cover in terms of the providers, you need to get into the evidence of coverage where they outline what exactly will be covered. So on the PPO, they talk about, having to use participating providers and intermittent home care from registered nurses, vocational nurses, physical therapists, occupational, licensed clinical social worker, home health aides, and related medical supplies. And then they talk about how how many visits per day. And of course, if you had 3 visits per day, that's close to 5 weeks of care. But, you may only have 1 visit per day, so that day we're looking at 3 months. It all depends on where you're at in your recovery. And they also discuss, this is the summary of benefits for the HMO, how if a visit lasts longer than 2 hours, maybe it goes 3 hours, that would be considered 2 visits. So, and if a visit is less than 2 hours, it's still considered a 1 visit. So you need to kind of dig into the evidence of coverage, because some of the stuff gets complicated and it gets confusing, and it's like, how is this all working? The next very important benefit that can be very costly is the skilled nursing facility benefit. So your accident may be fairly severe, or your illness, maybe you've had a stroke, maybe you had a cancer operation, and maybe you don't have a lot of support at home. Maybe you live alone and you really can't be at home because you really can't cook for yourself and do all the activities of daily living that you need because you're just not strong enough. So that's when the skilled nursing facility comes in, and they're freestanding. Sometimes they're attached with a hospital where they bring you your meals. The providers come to you in the facility to provide their services to you. Now, when you look at the summary of benefits, 100 days per benefit period, and there must be a 60-day gap between benefit periods. And this kind of mirrors what we see with Medicare. So, and it denotes that you can have more than 1 benefit period in the year. You could be in a skilled nursing facility for, say, 30 days, then you would need a 60-day gap. And if something else happened, then you could start another 100-day benefit period. However, when we look at the evidence of coverage, it's kind of murky exactly how that is all calculated. Member cost share. The skilled nursing benefit is definitely subject to any medical deductible within your health plan. So definitely the bronze plans and silver 70s. So you're going to have to move through the medical deductible of the plan, and then you go into coinsurance, which is a percentage of the cost of the service. So in this situation, it's kind of inclusive because the skilled nursing facility is providing everything. So if it's $500 per day and your coinsurance is 10%, because maybe you have a platinum plan, then it's going to be $50 co-payment for you, coinsurance essentially, 10% of the $500. But of course, once you reach your annual maximum out of pocket, then the health plan pays for everything 100% for the rest of the year. So here's the summary of benefits for the PPO. You can see up to 100 days per member per benefit period, 30% coinsurance on the silver plans. Doesn't make a difference if it's freestanding or hospital-based, and that is subject to meeting any medical deductible if you hadn't already met it. The HMO, very similar, skilled nursing services up to 100 days, 30% coinsurance, subject to the deductible. So it doesn't really make a difference too much whether you have a PPO or an EPO or an HMO plan. They all pretty much work the same, whether it's home healthcare or skilled nursing facility. The benefits are going to be the same. It's just who are the providers they are using. But of course, you need to get into the evidence of coverage. Sometimes the evidence of coverage doesn't give you as much information as I would like, but they do discuss, the skilled nursing facility. They also will limit, or they also will note the exclusions and limitations. And very specifically, they say that home services, hospitalization, or confinement in a health facility or primarily rest for or it's not for your residents. It's not there for custodial care. The skilled nursing benefit is there to help you get better. It's medically necessary. So they're not going to cover it just because you just don't want to go back home. And this is the evidence coverage with the HMO, and they talk about all the inclusive services that are provided that they will cover when you are in a skilled nursing facility, from respiratory therapy, physical, medical supplies, social services, imaging. So it's fairly comprehensive. None of us want to be in a skilled nursing facility. But if you're in pain and you've had a real nasty accident, then it's a safe place and the services are being brought to you. And again, once you meet your maximum out of pocket for your health plan, then the health plan is going to cover it 100%. And I've had several clients in that position. They've hit their maximum out of pocket. They're in a skilled nursing facility, or they're receiving home health care for another 3 or 4 weeks, completely covered by the health plan. Really, really valuable benefit within the health insurance within California, so that you can get back out on the trails or hiking around and enjoying life again. So if you have any questions or comments, you may leave those down below. I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knauss.